Good morning, everyone. I've got 10 o'clock. Let's go ahead and get started. This is the Anchorage Emergency Operations Center external operational update on July 21st. This is Luke Orritt in the plan section of the EOC. I'm filling in for Adam today. Last Friday marked day 500 of our response. Thanks to everyone for all of your time and effort you've put into our response. Moving on to the situation update. Today is day 505 of our response, and as currently reported, locally, we're up 494 cases in the last 7 days, with no new deaths and 8 additional hospitalizations. Statewide, up 940 cases, 0 deaths, and 24 hospitalizations. For 213 resource requests, we've filled or otherwise satisfied 1,794, an additional 2 since last week, with 8 currently working. In the Sullivan, we've got 311 clients. That's up 37 since a week ago. In the non-congregate shelters, 364 clients, up 6. That's 675 clients in all shelters, up 43, averaging 2,025 meals served per day. In the last 7 days at the visit testing sites, there were 3,002 sample collections performed. And in the last week at the PrEP mod vaccine sites, there were 107 doses administered, with 48,432 to date. And our vaccine numbers from the visit vaccine sites are temporarily unavailable. Weather.
Good morning, this is Michael Cutts with the National Weather Service out at Sand Lake. Looking at some rain through the day today with a frontal system that's kind of pushing in on us. Lingering showers through the remainder of the week and in through the weekend, with another frontal system expected to come pushing in probably on Friday night into Saturday and increase our chances for more rain. Some sunny breaks during the days, though, so it hasn't gone completely away. And breezy along, turning an arm and across the higher elevations today and tomorrow. That concludes my briefing. Are there any questions?
None heard. Thank you. Testing and vaccines.
Good morning, everyone. This is Pat Ryder, Emerging Infectious Diseases Assistant Program Manager. Today with testing, Visit Healthcare had an increase of 23.65% over the previous 7-day sample collections. Our community cases are continuing to rise. As of July 18th, our estimated daily growth rate is 5.2%. Our 14-day average reproductive rate is 1.301. And our 14-day average case rate is 17.3 for every 100,000 residents. Our current alert level is high. With vaccines, Visit Healthcare clinics had a decrease in the average daily vaccination of 33% from the previous week. We do have some upcoming pop-up vaccine clinics. Those include today at the Elastic Club and Yoga in the Park. Friday, we have the Fairview Rec Center, the O'Malley Golf Course, and the Arc of Anchorage. And Monday, we have the Civics Engagement Fair and the Bridge Restaurant. Just a reminder, our mobile vaccine clinics can come to you wherever you are, be it a church, business, or other organization. For more information or even to schedule, please dial 907-531-5100. Next slide, please. With regards to messaging from the Anchorage Health Department, as mentioned, our overall risk level is high. This is evidenced by the increase in cases from the municipality to a rate of 17.3 cases for every 100,000 residents, as well as the 67% increase in new resident cases from last week. That said, with approximately 57% of eligible residents ages 12 and older, and 59% of residents ages 16 and older having completed a COVID-19 vaccine series, Anchorage comprises 2 subpopulations with very different COVID-19 risk profiles. Unvaccinated individuals currently experience a risk for COVID-19 infection equivalent to an average daily new case count of approximately 19.6 for every 100,000 residents, while their vaccinated counterparts experience a risk equivalent to 2.0 for every 100,000 residents. Our consensus reproductive rate of 1.301 is higher than last week's consensus estimate of 1.19. Just a reminder that a reproductive rate above 1 indicates that the virus is continuing to spread. And finally, we continue to watch the following community factors which may increase COVID-19 risk within the municipality. These include an increased prevalence of more transmissible variants of concern, including the Delta variant, very slow increases in vaccination coverage, a minimal use of non-pharmacologic interventions, including masks and social distancing, and high numbers of travelers to Alaska for both employment and tourism. This concludes testing and vaccines. Barring any questions, end of report.
So we do have one question from the chat. When do our contracts for testing run out, or are they set for the fall?
We are currently working with that right now. Right now, we are tentatively planning a testing extension to the end of July, and we currently have an intent to bid out that's currently under review.
Thank you. Contracts and logistics.
Good morning. This is Wendy Reese, Contracts and Logistics Lead, reporting out. Mass care support, we continue to wrap up contract extensions that were approved during the 7/13 Anchorage Assembly meeting. We're working on funding projections to support mass care through November the 30th. COVID testing contract is extended currently through July the 24th. We're pending the final abstract for the awardee of the testing contract for review and purchasing. Vaccination contract, continue modifications to improve all vaccination capabilities. We are supporting ongoing staffing adjustments for the new personnel and extensions to meet COVID mission requirements. Barring any questions, end of report.
Thank you. Moving on to finance.
Good morning. This is Audrey Jo Malone reporting for Finance. Current encumbrances today sit at $22,880,461. Actual spent to date is at $66,726,339, with a total expenditure set at $89,606,800. We are currently seeking cost recovery for expenses by way of federal funding, and please continue submitting your invoices and supporting documentation to eocinvoices@anchorageak.gov. Report over.
Thank you. And for finance, that report's going to begin with a video. Give me just 1 second to get that set up.
First came the virus that had never been seen before, and that spread faster than we could ever imagine. Now we hear there's a safe and effective way to stop it. Vaccines that will protect millions from COVID-19. But can we really know they're safe after less than a year of testing? COVID-19 vaccines may be new, but vaccines are not. We've been using vaccines to protect against infectious diseases for over a century. 2 COVID vaccines are the first authorized vaccines ever to use a new technology, but even that technology, called messenger RNA, has been tested and studied by vaccine researchers for decades. We've learned how to make vaccines better and safer, and we've applied all that knowledge to COVID-19 vaccines. We also had a head start on COVID vaccines thanks to studies the National Institutes of Health had done. Scientists there actually created a vaccine that could be custom made to fight different strains of coronavirus, like the virus that causes COVID. Using these studies, they were able to make a COVID-19 test vaccine just over a month after the disease was first reported. All vaccines have to be thoroughly tested before they can be marketed. During clinical trials, scientists measure and compare data on volunteers who receive a vaccine to those who receive a placebo, like an injection of saline. Most early clinical trials involve fewer than 3,000 volunteers, so it can take a year or more to get the data needed to measure how well vaccines work. Early clinical trials for COVID vaccines enrolled at least 30,000 volunteers each, so data on safety and performance were collected and analyzed in under 4 months. Vaccines are usually developed one step at a time, and companies wait until they have final approval to start manufacturing them. But addressing this pandemic couldn't wait. So government and industry invested millions of dollars to produce vaccines at the same time their test data was under review. This meant health departments and clinics started getting vaccine shipments a few days after the Food and Drug Administration's rigorous standards for safety were met and the vaccines were authorized for public use. Thanks to extraordinary advances, science, industry, and dozens of government agencies have been able to work together to produce and deliver safe and effective COVID-19 vaccines in record time. Decades of experience and innovation led to this achievement, one that can keep you, your family, and your community safe from a serious and dangerous disease. Learn more, cdc.gov/coronavirus. We can do this.
And safety, if you'd like to go ahead with your report.
Good morning, everyone. There's so much hesitancy right now about the vaccine, about its efficacy, about the side effects. So the common side effects for those of us who have received it are maybe a little pain and redness and swelling. And for the second shot, it feels tired. You start feeling tired, you get a headache and chills, but they usually pass. They give you a nice handout of what to expect and when to call your doctor if they become more severe. So if we can just keep passing this along to our families, our groups of friends, and all of our coworkers and everything, so we can start getting everybody who's eligible vaccinated, then we can start fighting this with a really good fight and keep pushing back so that we can stay healthy and strong throughout our community, throughout our state, and anywhere else we travel to. End report.
Thank you, safety. PIO.
Thank you. This is Public Information Officer Heather Arono, and I wanted to start by thanking Safety for sharing that video. I think that it is so important to help remind folks of the process and deliberation that went over getting these vaccines out to folks. And as we see our cases rising, just really want to emphasize that we need to keep information about vaccines and the importance of testing prominent in the public's mind. So to that end, I wanted to highlight some of the things that we've been working on. Tomorrow, I encourage everyone to tune in to Mix 103.1 at 8:30 to hear Public Information Officer Laura Atwood talking about the importance of getting vaccinated and tested. And we are continuing our daily outreach to community and media members about vaccination clinics and testing. And below that on the slide, you can see a few examples of things coming up. So we have the Spinard Truck Food Festival. We have the Tasty Freeze is going to be hosting a vaccination clinic. We also have the O'Malley on the Green. Anchorage Golf Course is going to be hosting an event coming up. So there are many opportunities. Please, if you've been vaccinated already, help us spread the word so that we can get information to those who need it. I wanted to let everyone know that we have a special appearance from our Office of Emergency Management Director, Amanda Loach. She's going to be talking to us about the parameters on FEMA support, especially since there's been a flurry of activity in print and social media. We asked her to say a few words on this. So Amanda, I'll kick it over to you.
Hey, thanks, Heather. Good morning, everyone. Thanks for tuning in. Again, this is Amanda Loach at the Office of Emergency Management. Emergency managers have a saying about disaster response and recovery operations. They are locally executed, state managed, and federally supported. So I wanted to talk to you about that federal support piece today and just make sure that we have the facts out there, because there's been such a flurry of information going out in the media about this. On March 13th, 2020, the president declared an ongoing coronavirus pandemic of sufficient severity and magnitude to warrant a nationwide emergency declaration covering all states, tribes, territories, and the District of Columbia. Effective July 25th, 2020, the Secretary of the U.S. Department of Health and Social Services renewed the determination that a public health emergency exists as a result of the continued consequences of COVID-19. Due to the nature of this incident, it's necessary and appropriate to amend certain deadlines for FEMA's public assistance program on a national basis to meet the needs of our community and all those communities around the country. With respect to 100% federal funding, which was authorized by President Biden, the date of September 30th, 2021 only applies to federal share of FEMA public assistance. It does not limit the eligibility for emergency work that is funded under FEMA's public assistance grant. On that date, the federal contribution will revert to the normal 75% that is funded by the federal government, and the remaining 25% will be handled by the state of Alaska. There is no disaster-specific guidance which limits all funding to a time frame for this disaster. Emergency work under the FEMA Public Assistance Program is limited to 6 months from the date of the disaster declaration. However, this time can be extended upon a finding that the work must continue beyond 6 months due to extenuating circumstances or unusual requirements. On August 24th, FEMA extended the period of performance for COVID-related emergency work until further notice. We anticipate that until further notice will end with the conclusion of the national health emergency, but we have no confirmation of this at this time. FEMA will make notifications prior to the establishment of a deadline for completion of this emergency work that we are all doing here. MOA and our partners on this call continue to move forward with response and recovery operations. We are seeking reimbursement from FEMA for our emergency work. It's a process, but we continue to make progress. Thank you.
Thank you. Moving on, I will be covering the liaison slide today. Thanks to all of our partners who were able to join us today. Do have one report out. Ron Schwartz with UAA. Are you on the line?
Yep, I'm here. Just wanted to give a briefing on the fall semester. Chancellor Sean Parnell has approved our mitigation plan, and it starts August 2nd, a week from Monday, where we're going to open to employees and students who are preparing for the fall semester. Opening means that we're going to require masking for those that are unvaccinated. We're going to ask people to maintain 6-foot distancing in classrooms, labs, and offices whenever reasonably possible. We are going to have telework agreements on paper for the first time so that if at all possible, employees can continue to work from home and still give the service needed. But we do our own contact tracing within the safety office, so we are going to be leaving our buildings locked. Access will be granted using our university-issued swipe cards or a key. So we're going to see how that goes, at least for the remainder of August. And then finally, our residence halls will be open. We have a capacity of almost 1,000. And so what we have done is decided that all resident students will be required to be vaccinated. And we'll be continuing with testing to make sure that we're tracking both the resident students and those that are traveling regularly with athletic and academic research types of activities. Any questions? You can reach me at rcswartz@alaska.edu. Thanks.
Thank you. Do we have any other cooperators on that would like to report out? Hearing none, moving on to the hospitals. Matsu Regional Medical Center will not be joining us. However, they did provide some numbers. They have 4 COVID positives, 0 PUIs. 2 of those positives are in the ICU and 2 are vented. Is anyone on the line for Alaska Native Medical Center?
Good morning, this is Kirsten at ANMC. This morning we have 13 positives. 2 of those are in the CCU, both ventilated, and we have 1 PUI.
Thank you. Is anyone on for Alaska Regional Hospital?
I'm here. Alaska Regional Hospital currently has 19 positive patients, 5 in the ICU, 4 of them are vented.
Thank you. And we'll open the floor for Q&A. Does anyone have anything to ask right now?
Yeah, this is Sean Sugars. I just wanted to introduce myself. I am the VHA Office of Emergency Manager, Area Emergency Manager for Alaska and Idaho, and I work as the alternate LNO for ESF 8 for FEMA Region 10. So we are the liaison, or I am the liaison with the VA side for any of those services through HHS to FEMA to the VA for any of those medical services. So I joined your call here and been covering a couple months here for Alaska for their EM for the VA, and I know Brandon is on the call now. He is he's up here for a few months to support the Alaska VA as well. So thank you for letting me join your call.
Okay, now concluding the meeting. Our next operational update briefing will be 10 o'clock, July 28th, a week from today. Thanks for joining, everyone.